What is up, everybody? My name is Matt. I'm a paramedic, and today I want to teach you about the two types of patients you may come across in the future, even if you don't work in EMS. We as first responders can separate patients into the responsive and unresponsive category. In emergencies, it's a little harder to think straight. So for the responsive patients you come across, a simple mnemonic that you can use when trying to gather information is SAMPLE. The S stands for signs and symptoms. This may be a combination of both what you see and what the patient is telling you that they're experiencing. A stands for allergies. We as first responders want to make sure that we don't administer a drug to the patient that they are allergic to. M is for medications. Certain medications like blood thinners can make traumatic injuries much worse by preventing clotting. P represents past medical history. It's important to understand what medical problems people are typically suffering from so that we can treat the patient more appropriately. L stands for last oral intake, basically asking them when their last meal was and what they ate. And I'm not gonna lie, this one is actually quite irrelevant most of the time, but it could be important for patients who have diabetes and take insulin, for example. Finally, E stands for events leading up to the incident, or basically what happened right before their injury or illness started. Now, this is one of the most important pieces of information. We always want to know how a person was hurt or how their medical problem started, because it gives us a better idea of how to treat the person. So while you're asking these questions to the patient, you want to do a quick head to toe exam. Starting at the head, you want to look and feel for signs of injury, including pain, bleeding, burns, swelling, or any deformities. Now, usually the patient will do this work for you by, either holding their injury or looking at it, but sometimes there can be multiple injuries, so it's important to do a complete head-to-toe check. And finally, once you find any conditions or injuries, you're gonna wanna treat those. And I'll be creating more videos in the future about how to address certain types of injuries. So definitely hit that like and follow button somewhere on your screen. I don't know where it is, but be sure to smash it wherever it is, because you do not wanna miss out on learning skills that could help you save a life one day. So that's all I have for you today. As always, be kind to yourself, be kind to others, and please go wash your hands.